Thank you very much, Manuel. That was a more than generous introduction. You made me feel a little bit bigger than I am. Ladies and gentlemen, good evening. And thank you, first of all, for coming to this event. Earlier I was told there is political turmoil in the country, and I thought, okay, I've traveled so many thousand miles, and this place might be empty. Good that you're here with us. I'm here to talk a little bit about access to medicines in Africa. As I've been introduced, I work with Dumake Global Health in Uganda, and I also coordinate the Medicines Transparency Alliance. But before I start, how many of us have been to Africa? Show of hands. Oh, there's a sizable number. And have you been to Uganda? A few more have been to Uganda. Those who haven't come, you need to come to the most beautiful country, very green, very welcoming people. So come and visit. So just a little bit about my organization. We do innovative global health research, capacity building, but also develop policies and do engagements with policymakers to ensure there's health system strengthening. And we coordinate the Medicines Transparency Alliance in Uganda. The name Dumake comes from Duma, which is a cheetah. A cheetah is African, and we want to show that we are African, and we're strong, and we are moving. So I'll start with this slide here and the pictures here. Before colonizers came to Africa or discovered Africa, Africa had a health system that was working. The earliest surgeries were actually done in Africa. I was told that the first cesarean section was actually done in Africa. But when the colonialists came, our administrative systems were changed. Our health systems were also built based on something we didn't know. And when the struggle for independence ended and the colonizers left, they left us health systems that we have failed to manage. And so if you see the picture on the extreme right, we have become beggars. Our governments have failed to provide health for us. Almost 50% of our health budgets in Africa are funded through donations. The government spend less than 15%, but the households also bear a big burden. And so our governments are constantly begging. When we see the other one up on access to medicines because we had our traditional medicines that was taken away from us, modern medicine that was introduced to us. The big pharmaceutical companies are profit-minded. They're producing medicines that are lucrative, where they can make lots of profits. I think an example of a medicine that really breaks my heart is a recent medicine that was made for hepatitis C, Solvadi. Well, the discoverers of this medicine, they didn't discover it actually, they bought it. So they used less than $100 to make a 6 weeks course of this medicine. And we're selling it $84,000. How much does Big Pharma want to earn? So, and most of these medicines, of course, for us, we are chasing something we cannot catch. That's the picture here. And it leaves us with supply chains that are weak, as you'll see. And I'll continue. 25% of the global disease burden is in Africa. But if you go to infectious diseases, and I was happy to meet Mikhail, who is doing a lot of work in that area. If you go to infectious diseases like malaria, HIV, it's up to 90%. 98% of maternal deaths are occurring in Africa. But we are only consuming 1% of the global health expenditures. People do not have the medicines that they need. Although the medicines market, the pharmaceutical market, is growing. It's expected to reach 260 billion in 2030. But most of these, again, up to 90% in many countries of this medicine is coming from outside of Africa, from China and India. And this dependence on medicine from elsewhere is a big challenge, as we also during COVID. In Africa, we thought we were going to die because the big nations were fighting for all the medicines that are being produced. They pre-booked all the vaccines. We were left. Somehow, we managed to survive. But should that keep going on? I don't think that's the way we all want to operate. And so, if I zero down to neglected tropical diseases and neglected conditions like snake bites, which we've been talking about, you know, this is a condition that is affecting a very young population, 10 to 30-year-olds, mostly people in farming, very poor communities, and the incidence in countries like Uganda is high, particularly in the rainy seasons. But when we did a study, we found that 92% of health workers did not know how to treat snake bites. Most of the snake bite treatment was done supportively. The health workers will treat a symptom that they see. 96% of facilities did not have antivenom. But even for the supportive medicines, was not readily available. Stockouts were prevalent in the public sector. But then in the private sector, antivenom on the African continent is only made in South Africa. But I think for the last 2 years, that plant has also closed. But a vial was a treatment required about $600, which is sometimes a year's earning for these poor families. And so they can certainly not manage to afford the antivenom. In Uganda, we were importing antivenom from India. That antivenom from India was made, if you know how antivenom is made, snakes are milked, and this is injected into horses. Very simple, very simple. And then you collect the antibodies from the horse, and that is the antivenom. But in Africa, we are not producing it as simple as it seems. In Uganda, we are importing antivenom from India, made from varieties of snakes in India, and so the antivenom was not working. They needed so many vials to treat a snake bite. Why should this happen? And these are some solutions. Germany has done a lot. We know that you also have an agenda for local production, focusing, having your own production and not depending on outsiders. But I know that a lot of the mission work in Uganda is also done by Germans. But I think we should move away slowly from mission work. Don't give us fish, teach us how to fish. As we've been shown by COVID, we need a more self-reliant Africa in terms of us producing our medicines, and what the German government can do is to support these local production initiatives that are happening in Africa. There are a number of them. The Africa CDC is doing a lot of work The African Union Development Agency, NEPAD, is also doing a lot of work. But what the donors are doing now that the agenda is on local production is to dangle money for development, for this development work, so that people then are chasing the money and forgetting the real work that needs to be done to make us self-sustainable. If the support that is being given, this support should come to helping young Africans through training, collaborations with universities, exchange programs, technology transfer. We've seen some very good programs that are doing contract manufacturing. If there is manufacturing that you can let us do for you and build our capacity, it also helps us in the long run to develop the capacity to develop ourselves. Don't just take away the good people we have. Make sure that we're training and people can go back and develop the continent. There is need also, as I said, Germany is helping a lot of mission work, but the German money also needs to go into empowering communities to hold their duty bearers accountable. If German is putting money into research, we should see that that research is having impact and it's going to medicines for the poor, not just getting public money to fund production of medicines that are lucrative and then leaving the neglected medicines alone. Sickle cell disease is predominant in Africa, but there is no medicine produced in Africa for sickle cell disease. Why? Are we going to wait for other people to produce for us? I think this is where I come in. Help us to help ourselves. Help support civil society to hold our leaders accountable. If German government is putting money into Africa, it also needs to have those governments match that funding and ensure that the funding has impact. And transparency in all these discussions is very, very important. We need to know where is that government money going and what impact does it have on the communities. So teach us how to fish, don't give us fish. Thank you.